I'm going to address the top question of the day, and that is what are we doing about so-called shelter in place? So first, let's just be clear on what shelter in place means. This is an emergency term for the public that means stay home, don't go out, basically lock down because the danger is passing through. It can be used for hurricanes, it can be used for nuclear fallout, and it's typically used for something where you think that the danger is going to pass by in a matter of days. People are using the term shelter in place to refer to different approaches to social distancing around the country, and in particular this notion of ordering people to stay home and only go out for their essential needs, which would be, of course, food, childcare, if they're essential workers. I want to be really clear that as health system leaders talk about this, as public health people talk about this, in our region, we are unified in our shared priority of social distancing, which means physically distancing from as many people as you can for as long as you can. Staying home and only going out for essential services is certainly part of that definition, but we also recognize that people need to go out for different reasons, and as government, we are obligated to exhaust all voluntary measures to encourage the kind of behavior that we want to see before we go to a type of legal order and an enforcement pathway. So I just want to be really clear and emphasize that we do want people keeping to themselves, limiting the number of people that they interact with, limiting their outings and mixing in large groups as much as possible. I do get reports of people in bars, people gathering in parks. I think everyone is worried, and rightfully so. I am worried too, and right now the best thing everyone can do is use common sense, take care of your needs, but please, please limit your contact with others as much as you possibly can. And that really goes for this upcoming spring break. I would urge people to do a staycation and stay local, stay to your household, keep to your household, and stay with people that you are normally around. With that, I'm going to turn it over for some additional comments and rationale to Rachel Banks, our Multnomah County Public Health Director.
Good afternoon. My name is Rachel Banks. I'm Multnomah County Public Health Director, and I want to echo what Dr. Vine said, that we are all unified in supporting social distancing, or I should say physical distancing measures. And so across 4 counties in the metro area, over 8 health officials have come together to consider social distancing. And while we want to be absolutely clear we support physical distancing, it's also our job to consider some of the unintended impacts and the downsides of that. We wanted to acknowledge the behavioral health impacts of such an order, given the reality that we will likely be in this situation for quite some time. And we really considered the idea of insisting that people stay outdoors and how that impacts our message of physical activity, both from a physical and a behavioral health standpoint. The spread of this virus has, just in a few weeks, shined a spotlight on social inequities that have been long-standing and created by policies and practices. And those disparities and injustices have developed over many years, including income inequality, racial health injustices and disparities, food insecurity, patchy healthcare access, and disparities in education. So despite ongoing efforts among leadership and communities, there are no quick fixes to this issue, and we just wanted to ensure that our guidance to ask the community to social distance doesn't create further harm. And with that, I'll pass it over to Dr. Present.
Hi, I am Dr. Sarah Present, Deputy Tri-County Health Officer and Health Officer for Clackamas County. I wanted to just take a quick moment and describe some of the details that we've been getting questions about. Definition and enforcement of essential outings is really difficult, and it risks spending time that we can be better spending on efforts to really prepare our health systems and provide essential services to the individuals and families that we are already grappling with the sweeping measures to limit gatherings and close school, businesses, and buildings. We really encourage all Oregonians to think about what is essential to them and limit your outings, limit your exposures to others as much as is feasible and possible for you. We also really want to acknowledge the behavioral and mental health effects of such an order. given the reality that we will likely be in the throes of this pandemic for the next several weeks, if not months. The idea of insisting that people remain indoors as our weather in Oregon improves goes against what we know about the physical and behavioral health benefits of being outside, especially in times of stress. The risks of transmission outdoors is considered very low and likely incredibly minimal if you follow the 3-foot rule while you are outside. In regular times, we know that social isolation in the home is of particular concern for certain communities, including rural communities, immigrants, refugees, and communities of color, as well as our elderly and our youth. We do not want to risk people feeling trapped indoors or afraid to fill their essential needs. So as long as you can maintain the 3, if not 6-foot rule, we encourage you to enjoy the sunshine, get your physical exercise that will help your overall health and well-being through these stressful times. And now I'll pass it over to Tricia Mortel of Washington County.
Good afternoon. Thank you. I'm Tricia Mortel, Washington County Public Health Manager. Our public health workforce has been committed and actively working to help those diagnosed with COVID-19 in our community. Our staff continue to work 7 days a week to slow the spread of this illness. We are supporting families who are in isolation. One way we are doing that is supporting basic needs of our families by delivering food for those who need to stay home. And we are collaborating with dozens of community-based organizations to meet the needs of the most vulnerable in our community. We know that physically distancing ourselves from others is isolating and can be damaging to emotional well-being. So like all the other counties, we are actively pushing out messaging and ideas about staying socially connected in creative ways. Public Health and our chair, Catherine Harrington, would like to thank the Washington County community for implementing physical distancing recommendations and requirements required by the governor. Your efforts will make a difference for everyone in the Tri-County area. Washington County, in addition to being focused on supporting families who've been diagnosed with this disease or are concerned about being diagnosed with this disease, we are supporting, we've announced today that many of our offices and programs are closing in-person services as appropriate and switching to telephone and online methods, again, for physical distancing. We're assessing economic impacts to individuals and employers and developing strategies to provide support and assistance. And like everyone else, we're addressing stigma and racism by promoting and delivering positive messages. We're in this together as a community.
And I'm Dr. Joe Scaraya from Columbia Health, Columbia County. And you know, in closing, I want to put out that we are all unified in our approach to how we're approaching COVID. We often get a lot of questions about what individuals can do about COVID. And really, by practicing the social distancing, that is what individuals can do the best to really help kind of curtail the curve that we've been trying to flatten. So with that, I'll turn it over for questions.
Thank you all. It's great to have our full regional group here. We're often teleconferencing, so we're practicing social distancing today, but it's a real pleasure to have them here in person and for you all to get to hear from them directly. I think we're going to open it up to questions. I've been instructed to start with the phone. So does anyone on the phone have a question for anyone who spoke? I hear a voice far away.
Just turn up the volume.
From the Oregonian.
Yes, I can hear you. Hi.
Oh, okay, great. Hi. Yeah, I did have a question for the Multnomah and Washington County health officers. Today, cases in both those counties were announced, and I'm wondering, both for the specific cases today and generally speaking, if you're going to be providing more demographic details about these patients. I know that there's been kind of, in some counties there has been more specific details provided about, who these people are, what age range, what gender they are, and how they, how they got the disease, whether that was travel or community transmission. And so I'm wondering if you can offer that information today.
Sure. So just to repeat the question, this is coming from the Oregonian. Oops, I need to turn this down because of my echo. Question from the Oregonian noting that case counts have ticked up for both Multnomah and Washington counties, wondering if and how much demographic detail we're going to be sharing with the public. I'm going to let Washington County speak. I can say that in the early days of an outbreak, when case counts are low, we are much more restrictive with what we reveal because medical privacy is more in play. Unfortunately, as case counts go up, we can offer more general details and start to create a picture of what community transmission looks like locally. And let me turn it over to Tricia Martell for comments from Washington County.
Yes, Washington County as well needs to protect the privacy of individuals. But I think we've been releasing important information about what this disease is looking like in the community. If you look at the demographics, we still are most concerned about those in the older age groups. I think that's the important message.
And so at this point, will you be collecting that information and publishing it somewhere? Like, can people who are interested access, like, you know, kind of overall, like a place to find out that information, like these are the people that have been affected by this disease in the county?
Yep, got it. I gotta turn you down. Okay. So follow-up question from the Oregonian about where people who are interested in those types of details can go for them. The Oregon Health Authority is the keeper of the data in terms of the case counts and the specific details, and when press releases go out with new updates that the public needs to know. So I would direct you to their website. Anything to add? Yeah, that's it. Correct. In general, the counties will not be releasing specific details about their cases. Thanks. Any other questions on the phone?
I have a question to say with K2 News.
Okay, K2, go for it.
Okay, so we're learning about infected people with no symptoms who have spread the coronavirus in different reports. Can you guys talk about asymptomatic spread and if this is a concern in this community?
Sure, I'm going to turn you down so I don't echo. I'll repeat your question. So the question from K2 was about reports of asymptomatic spread. That means somebody who's not showing any cough or respiratory symptoms, who is testing positive for the virus and who is thought to potentially be able to transmit the virus to someone else. We know that science is out there for people who I guess we could call carriers of COVID-19. It's unclear to what extent they play a role in disease transmission. I think we have to assume they play some role in disease transmission given how quickly this virus has spread. That said, we continue to focus on people who are coughing, sneezing, and spreading those virus-laden droplets to their closest contacts.
Dr. Vines, can I ask a question?
Yeah, it was a question there.
What's the main takeaway that you want the public to know today?
So today, the main takeaway for the public is that we, at this point, are not doing any kind of quote-unquote lockdown or shelter-in-place recommendation from a public health COVID-19 standpoint. That said, the spirit of that approach that other communities have taken, we fully share, which is that people should be staying home and should be staying away from others as much as they possibly can.
What do you make of the city of Portland drafting a shelter-in-place policy and possibly implementing it despite county resistance?
I can't speak for the city. I can understand the urge for elected officials who feel a huge responsibility. Oh, I'm sorry, I'm supposed to repeat the question. The question was my response to the idea that the city had drafted a shelter-in-place order despite a different direction from public health. So I was saying that I understand our elected officials feel a huge responsibility to protect this community. They have heard clearly that measures to prevent spread, they need to be early and they need to be big, so they've clearly heard us on that. I think our messages have been clear that we are expecting a lot from our community now in terms of staying away from other people and keeping to themselves as much as they can. So I think at this point, again, we are obligated to make sure that we have put in place whatever it takes to get people to voluntarily do what we ask them to do from a public health standpoint before we get to the point of an order of the type that the mayor drafted.
I have a similar question. So what would it take for you to recommend a shelter in place? Is it what you kind of hinted at, like if people are not following these guidances that you're suggesting, that's when you would probably recommend it?
So follow-up question is, what would it take to put in place a shelter-in-place order? I don't think we have a defined threshold for that. Again, the situation has moved very quickly, and it was a matter of weeks ago that we never dreamed we would close schools, and now, of course, schools are closed. So I think we have to stay open to all the tools that we have. I think we have more work to do. I think there are more areas where people are gathering, where we need to get the message out, and in particular around spring break and young people. So please, those of you with a media platform, urge people, young people especially, who are gathering and going about their lives. We really need them to hear us and to be keeping to themselves and to be keeping to very small groups and not mixing with other people.
Hello? Nigel Jacobs from Multnomah. Could I ask what the county knew about the Fred Meyer at 66th and Gleason having 2 infected workers? What did you know and what did you do about it, please?
So question from Nigel Jacobs about the workers at a Fred Meyer with COVID-19. What did we know and what did we do about it? I would have to talk to our communicable disease investigations team for specifics on that. But in general, I've said before that we're not notifying employers per se, because we know the virus is in the community, and so focusing on and potentially stigmatizing one specific location when people may be getting infected elsewhere in the community, we don't feel like is good public health practice. That's why we're urging overall recommendations around washing hands, staying home if you're sick, and everybody being cautious.
Hi, this is Julia Silverman from Portland Monthly. I wonder if you guys are considering asking grocery stores to limit the numbers of people that can come in and out. Is that something that might be coming down the pike in a couple of days?
Mm-hmm. So the question was about if we'd be working with grocery stores to limit the number of people coming in and out. I think my understanding is some local grocery stores have already taken steps similar to that, and I think that is certainly the kind of thing that we would like to do, again, to encourage people to spread themselves out, to limit their contact with others, and most of all, to make sure that they're meeting their essential needs in a safe way.
Are you guys considering shutting down public transportation at all, or limiting that to the hours? Is there something that can be done there to limit the spread?
There's a question in the room about whether we'd be shutting down public transportation or otherwise limiting the hours. I would say I've had direct conversations with leadership at TriMet. They are committed to doing the right thing, keeping their workers safe and keeping the public safe. When we did the mass gathering ban and subsequently closed schools, we know that their ridership went way down. So we are understanding that buses and MAX trains are much less crowded. We've also emphasized that buses and MAXs have doors opening and closing frequently, which creates for good airflow. And again, we're encouraging everybody to stay home if you're sick. And again, today we're saying please avoid anything that's non-essential. You really should not be out and about.
The CDC mentioned that young people, I thought I had read that one of your professionals just mentioned that young people were getting COVID-19 at 48% or some percentage like that. I don't know if young people perceive this as something that they're getting. So how do you, if you're not releasing details on these people who are sick, how do you get that message across to young people?
Right, so question in the room about recent Centers for Disease Control report citing that a surprising number of young people are among those hospitalized among the known cases of COVID-19, and how do we get the health message to those young people who may not perceive that they're at risk? I'm asking for your help with that today, to say that they may very well be at personal risk, and from a community standpoint, to the extent that they mix and gather in large groups, they are potentially putting the community at risk by speeding the spread of this virus. And again, we're looking for the opposite. We want to slow the spread by having people spread out and maintain as much physical distance from each other as they can, while staying in touch, of course, socially. I think, did we have another question from the phone? Okay.
This is Catherine with K2 News. Can you hear me?
Yeah, okay, yep, K2 News, all you.
Okay. Yes, so Governor Newsom announced today that he predicts 56% of Californians will get the coronavirus. What do we know about these statistics? What are we concerned about in Oregon being a neighboring state?
So the question is about the California governor's prediction that 56% of Californians will get the virus, and how is that affecting our planning as a state? Yeah, that's the question. Okay. Okay, so I know That's a question for the Oregon Health Authority, who's leading with OHSU and other experts, including from Multnomah County, leading the modeling components of this work to understand disease spread, to understand how quickly it's spreading, and to prepare for the numbers of people we think are going to need hospital level care or higher. So I can't comment right now on what the California governor's statement means for Oregon. I'll be looking to our state to help us understand where we are in this outbreak and what may lie ahead.
Thank you. This is Alex with the Portland Mercury. Can you hear me?
Yes, Portland Mercury.
Great, thank you. I just wanted to double check. It really sounds like public health officials' definition and your definition of social distancing right now is really similar to how the city of Portland and other jurisdictions' ideas of sheltering in place is. It sounds like there's maybe a definition issue with what other, if there's a storm or a national disaster, kind of how social distancing or how a sheltering in place is used in that term. But would you say that your recommendation for social distancing is pretty much in alignment with how the city's understanding sheltering in place right now?
Yeah, so the question is whether our local public health definition around sheltering in place is aligned with the city's understanding, and I would say yes, it is. And we do also have to allow for people needing to go out to meet their essential needs. We need our healthcare workers to be able to work. We need people to take care of their children so they can work. So again, with some exceptions, we are asking anybody who can to please stay home and limit contact with others.
Got it, thank you.
You've been listening to a press conference held by health officials from the metro area on both sides of the river talking about the need for social distancing. At this point saying no shelter-in-place order is needed, but stressing social distancing is of utmost importance so that a shelter-in-place order does not have to be given. We're going to